USMLE, Step 1. Year 2024, number 0622. A 50-year-old female patient consulted a doctor with a headache and complaints of abnormal sensations in the left side of the body. She claims that sensory changes have taken place rapidly in the past few hours. Her laboratory reports are normal. A lumbar puncture shows normal cerebrospinal fluid, CSF, and her mental capacity appears to be good. The doctor performed a neurological examination and found that the patient had significantly decreased sensitivity on the entire left side of the body, including the face. Sensory loss includes all modalities. Motor examinations are normal, as are visual and hearing examinations. Based on neurological studies, which of the following thalamic nuclei will be involved? A. Pulvinar. B. Lateral and medial geniculate nuclei. C. Ventral anterior and ventral lateral nuclei. D. Lateral dorsal and lateral posterior nuclei. E. Ventral posterior lateral and ventral posterior medial nuclei. Nuclei of the thalamus, lateral geniculate nucleus. Visual pathway, medial geniculate nucleus. Auditory pathway, lateral dorsal nucleus. Integrating sensory information, lateral posterior nucleus. Integrating sensory information, pulvinar. Visual attention and other integrative functions, ventral anterior nucleus. Motor functions, connecting to the motor areas of the cortex. Ventral lateral nucleus. Motor functions, connecting to the motor areas of the cortex, ventral. Posterior lateral nucleus, VPL. Somatosensory pathway from the body, dorsal column, medial. Lemniscus pathway. Touch and proprioception, spinothalamic tract. Pain and temperature, ventral. Posterior medial nucleus, VPM. Somatosensory pathway from the face, head, and oral cavity. Trigeminal nerve, cranial nerve versus touch, proprioception, pain, and temperature. Information project by VPL and VPM nuclei is relayed to the corresponding part of the primary somatosensory cortex, S1, located in the postcentral gyrus of the parietal lobe to be further processed. The answer is E. Ventral posterior lateral and ventral posterior medial nuclei.